everybody gonna say they're not a bad nurse? Everybody's a good nurse, but we have what, 4 patients on this unit, sometimes 5, sometimes 6. We work long hours. We got different types of patients. So when you're going in and out of this room, is anybody perfect? Nobody's perfect here. Neither are pilots. They have a checklist before they fly. They fly planes every day, they do X, Y, and Z. They have a checklist to make sure they don't miss anything. They're smart, they're intelligent, but they can make mistakes. They can get busy. As nurses, we are busy, we're smart, and as modern nurses, we're having more and more workload put on us. I will guarantee that we have a lot more knowledge than a nurse 20 years ago. We're also responsible for a lot more. This unit, head and neck, huge. That's a lot of work on us. Matter of fact, you got that, you're down to 2 patients. Those 2 patients will keep you busy. So to ensure you're not missing any steps or you're not forgetting anything, bundles are a checklist for us. You can go through, it should be done shift, you're checking off to make sure, hey, if I got a central line, what? The covering's done correctly, the needle's in place, the bio patch is in there, we're getting CHG, and it's labeled, and if we have lines, we're labeled and all that. So it's a checklist to make sure that we're doing it. It's a checklist that you pass through each time you're doing bed shift report, and it's part of checklist you do whenever you're doing your evaluation of the patient. Introduction to the problem. The problem I started noticing when I was doing this, picked this up as a project, there was a lack of use of bundles. Study has shown that the lack of bundle usage is greatly impacted by the lack of education and understanding what bundles are. One study showed a compliance rate of only 38% before compliance. So big hospital, they did this research in, 38% of the staff was in compliance with those bundles. After education, 94% was achieved for this. And this was an ICU setting where they had what's called ABCDE bundles: awake, breathing coordination, delirium monitoring and management, and early mobility. These are all bundles. So you're in an ICU, this bundle's in effect, and it's only 38% of the nurses that are doing it and implementing it. That's a huge red flag, huge red flag. With this, I also had to do what's called a peacock question. You got the P, which I'm a little rusty on these, so let's look over here. The P stands for the population. So we're talking about the populations in a hospital setting. You've got the I, which means the intervention. How does the promotion of training and implementing of current health bundles on floor staff? You got C, which is the comparison, compared to the management not training or reviewing health bundles on a floor staff.